Patient with recent findings of Meniere's disease from her ENT PCP. She's on diazide, which is a blood pressure lower, but it's working with potassium levels, which can affect potentially vertigo symptoms, but that's more when there's a tear or an opening in the round or oval window of the vestibular apparatus. In this case, the patient has had dizziness for 2 years. It's exceedingly getting worse. She has nausea. In the past 2 or 3 months, her headaches have gotten extremely bad, especially in the frontal sinus region. She noticed that 2 years ago is when this started, that she was picking up her kid's car seat, and it was, she's doing that repetitively, of course. And then she started to notice some shoulder pain up and through here, started up into the neck, and that's when she started to notice a lot of the ear pain, the dizziness, vertigo, some of the headaches starting. She's seen ENT, PCP, a neuro-PT. The neuro-PT has been working on the SCM scalene muscles here, which has seemed to help a little bit, but it only lasts for a short amount of time. The ENT, they seem to believe it's Meniere's disease, but she's not convinced that it is, and she's correct. What's happening is actually, if you palpate, she has C1 is quite restricted laterally and posteriorly on the right side, which is creating the pain in and around the ear and the fullness of the inner ear. As these joints and muscles contract and restrict, they're creating inflammation and pressure, which is giving that result. They're affecting the C1 nerve, which is giving the frontal sinus pain. They're compressing the vasculature back here in the nerves as they go forward, giving her headache symptoms in the tension or frontal sinus region. And essentially what she's seeing is that the reduced activation and the reduced motion of the proprioception in this region is altering vestibular, cerebellar, and brainstem function on the ipsilateral side. So now she's getting dizziness and vertigo sensations because the apparatus and the actual neck are not matching up, they're not communicating. Therefore, the message system is off, the interpretation in the vestibular area is going to be off. So now everything is just resulting. It's progressing because if this is not fixed appropriately, this tension, this loop that's going on here between the neck and the brain is going to continue to get worse. The muscle tension is going to increase. The dizziness is going to increase, which she's noticed. She's started to notice nausea. The headaches have gotten way worse in the past couple months, so it's all related. And then, there's a couple other things going on, but those are the major causes. A very, very simple case that has been kind of misdiagnosed, by a lot of other people, that is going to be easily fixed here in just a few short weeks.